Dear audience and dear chair, my name is Melinda Antal, and in my thesis, I would like to discuss the optical and mechanical properties of dental ceramics. Allow me to introduce myself quickly. I'm a dentist and a PhD student at Semmelweis University, Department of Prosthodontics. My vision is to provide patients the best all-ceramic restoration, and my mission in this would be to supply dentists the guidance about the appliance of different dental ceramics. I have two specific goals for now, which are strongly connected to each other since both of them investigate a dental ceramic called zirconium dioxide, or shortly zirconia. In my first project, I would like to compare the mechanical properties of additively versus subtractively manufactured dental ceramics with the method of a systematic review and meta-analysis. Basically, over the past 35 years, CAD/CAM has become an increasingly useful technology in dentistry. It basically allows you to produce all ceramic restorations even in your own dental office. When talking about this method, the manufacturing is mostly milling or subtractive manufacturing, which is widely available. However, it has big flaws like wasting a lot of raw material that cannot be recycled and causing the wear of the milling tools, so overall production can be very expensive. Recently, a new method, printing, or in other words, additive manufacturing, has emerged in literature. As you may know, printing is the method of building objects layer upon layer. There are many available techniques, but the two most popular ones are stereolithography and direct light processing, both based on the concept of photopolymerization. Printing has big potential because it could overcome the disadvantages of milling, like hardly wasting any material and creating multiple objects at the same time with the finest details. But whenever a new material is introduced, mechanical properties are the most important to consider. When we want to see if printed materials could overcome milled materials, we have to be sure that they are at least as strong as milled materials, and the most important property to evaluate would be flexural strength, since it helps to predict the performance of a restoration. So this leads me to my aim, comparing the mechanical properties of additively versus subtractively manufactured dental ceramics. This leads me to my clinical question: do mechanical properties of dental ceramics differ when produced with additive versus subtractive CAD/CAM manufacturing? My population is dental zirconia. I would like to compare additive to subtractive manufacturing. My primary outcome is flexural strength, and my additional outcomes are Vickers microhardness and Weibull characteristics. I hypothesize that additively and subtractively manufactured dental ceramics have similar mechanical properties. My implication would be really simple: to provide patients better and cheaper restorations. Here you can see the details of my systematic search that I conducted in 4 databases, and after the selection process, I ended up with 196 included articles. On the upcoming slides, I would like to introduce my results for flexural strength, Weibull modulus, and Vickers hardness. So flexural strength is important since it helps to predict the performance of restoration. Weibull modulus gives us information about the reliability of the strength of the material, and hardness shows us how the material can withstand wear in the oral cavity. I would like to introduce 7 figures, starting with my primary outcome, flexural strength. Here we can see the results for the 2 armed studies comparing 3-point bending strength of milled and painted zirconia. Our outcome is mean difference, and if the article is on your right, then the milled material was stronger in the study. We have an overall mean difference of almost 180 megapascals, and although this is clinically relevant, it hasn't reached mathematical significance, suggesting that printed zirconia is as strong as milled zirconia. And although printed materials have come a long way and are closer and closer to milled materials, there's still room for improvement, and we believe that they shouldn't be applied in the same indications yet. We can see a higher mean difference value for the 2 arm studies comparing the biaxial flexural strength of milled and painted zirconia, but the conclusion is the same. Although the results did not reach mathematical significance, the difference emphasizes that printed zirconia did not yet overcome milled zirconia, and that they shouldn't be applied in the very same indications yet. We included many one-arm studies among the two arms one. Here, instead of mean difference, our outcome is pooled means. We have we created subsets based on the yttria content of zirconia. So dental zirconia has usually 3 to 5 more percent yttria in it. And to put it simple, the more the yttria, the better the aesthetics, but the weaker the material. We performed subgroup analysis based on the manufacturing as well, so printing or milling. You can see the results on this summary plot, and if we look at the 3-point bending strength, we can see this mentioned pattern, which is already well known in literature. So increasing the yttria content of zirconia decreases flexural strength, also giving us significant results if we look at the biaxial flexural strength data. But what I would like to show you is if we look at the 5 mole percent yttria stabilized zirconia, it has higher strength values that the same zirconia produced with milling, which emphasizes that with printed 5 mole percent yttria stabilized zirconia, we could get really good aesthetical results without compromising for much lower flexural strength. And it also emphasized that maybe the strength of printed zirconia is not as much influenced by the yttria content. We investigated variable modulus as well, so this shows us the reliability of the strength data. Here we can see the results for the 2 arm studies, which shows us the difference between the bimole modulus of printed and milled zirconia, measuring the 3-point bending strength of the material. We have an overall mean difference of a little bit more than 1. This is a dimensionless parameter, and it basically shows us that the reliability is the same between the milled and printed zirconia. Again, we have a higher value to this variable modulus with the materials measured with biaxial flexural strength. Still, it isn't clinically relevant, and this indicates that printed and milled zirconia have similar reliability. We included again many one-arm studies where we are working with pooled means, and if we look at the data, we can see that HLA-produced zirconia, which is a printing method, is significantly more reliable than milled zirconia. And lastly, I would like to introduce my results for Vickers hardness. Here we are working with an overall mean difference as well, and the results have not reached clinical and mathematical significance, showing us that printed zirconia could possibly withstand the wear in the oral cavity, the same as milled zirconia, and it could consequently cause wear in the opposing teeth just as much as milled zirconia. Our included studies have the strength of measuring flexural strength in a standardized way. We have included many 1 and 2 arm studies as well, and we are exploring all methods for flexural strength testing and also variable analysis as well. And we included every adequate printing method that could give us dental zirconia with the finest details. But these articles use different brands of zirconia, different manufacturing techniques, and the specimen dimensions, which leads high heterogeneity within the studies. Overall, we can conclude that printed zirconia did not overcome milled zirconia yet, so they cannot be used in the same indications, and printed zirconia for now is more suitable for temporary restorations, but 5 mole percent yttria stabilized zirconia could give us really good results in the anterior region, so further investigation is needed on this material, and also we need standardization regarding the processing of printed zirconia, and we need separate guidelines for each printing method. Here you can see the status of my manuscript, my submission, and my first project, and allow me to move on to my second topic, which investigates the effect of material aging on the color stability of dental ceramics, again with the methodology of a systematic review and meta-analysis. So the introduction of improved materials and fabrication technique changed the aesthetic restorative treatment patterns and resulted in a higher higher demand for aesthetics in dentistry. This led to the worldwide spreading of all ceramic restorations, which can successfully mimic dental structures. Dental zirconia is one amongst the most popular dental ceramics. It has excellent properties, and with the introduction of more translucent versions, it can be applied in the anterior region as well. But whenever we place a dental material into the harsh environment of the oral cavity, it ages just like zirconia ages just like every other dental material, and aging can affect color. And since patients care mostly about appearance, color stability is a crucial factor throughout the functional lifetime of a restoration. This is why my aim is to investigate the color stability of dental zirconia. This leads me to my clinical question. Does the aging of dental zirconia affect its color stability in vitro? Our population is dental zirconia again. I would like to compare thermocycling, mechanical and chemical aging, and compare it to the material before aging, and my outcome would be color difference. And I hypothesized that the aging of dental zirconia does not affect its color stability in vitro, and my implication would be really simple again, to provide patients long-term aesthetical restorations. Here you can see the progress regarding my second project, and here you can see the summary of my two ongoing projects investigating the mechanical and optical properties of dental zirconia. And allow me to end my presentation with my favorite verse from opera: "Failure is a great teacher, and if you are open to it, every mistake has a lesson to offer." Thank you for your attention.
Could you go back for the situation of the first project, the paper situation, because it was only a half a second. Yeah, to that. So this is submitted just now. As usual, one day before the exam. Yeah, as typical. Okay, and just have a look. Okay, thank you. So 3D printing, I think, is one of the technical improvement of the medicine, and it's really the future. What do you think? You showed that it's not better than the other methodology, but what will be in 10 years? It's not easier to do with the printing, comparing with the other method. If it's not better, but it's not worse, which methodology is better, and which methodology will be used in 10 years or in 20 years? What do you think? What is your...
Thank you for your question. So I really hope that we will use printing 10 years from now. It's not as strong as milling yet, but it shows a really good improvement in the recent years. And I think but that with the rate, this improvement rate, it could overcome milling, since although the
Is it
machine,
to do easier?
I think
Very or not?
yes, it can be easier, and also so it's easier because we have a platform and we can print many restorations at the same time. The machine is automatic, just as in the case of milling, but if we use milling, we can only print one restoration at a time. But with printing, I could, at the end of the day, just get all my data into the machine and print not only for one patient, but for example, 50 patients. The price regarding material is cheaper, but the machines now are more expensive. So we need to get to a state where we can afford these machines in, for example, each dental laboratory or dental office. So it's an investment, but I think that on the long term, it is much more sufficient than milling. Also, if we buy material for the printing machine, we will get it for a cheaper price than for milling, because for milling we have just blocks that we can use to mill the material. But if we want to use a block, for example, a bridge, then we lose less material. But if we only use it for one crown, like 30% of the block will be just become into little shreds, and we cannot recycle it, so it will be wasted.
What do you think? Is there any age dependency regarding the metals? I'm a pediatrician.
Yes.
I can guess that for pediatric patient, the printing is perhaps not so good than for an elderly patient. I don't know, but what do you think?
So basically, my topic is about dental zirconia, which is a dental ceramic. It is really strong. That is why we like it. But because it's ceramic, it has no metal in it. So it has really good aesthetical results. But what do we use dental zirconia for? We use it for bridges, for crowns. We can also use it in different parts of medicine, like orthopedic prosthesis. But these are mostly used for patients above 18. So I would say that this technique is mostly suitable for adults.
Not too many data for pediatric patient because we don't
Yes.
need it. But there are traumas, there are accidents, something else that you should use it even for pediatric patients. So you
Yes.
should use something at least for pet patient also. With the years of can with an accident or something like that if it happens. So what do you recommend then for you have data probably mostly above 18, but theoretically, what are the possibilities for younger kids?
So basically, this data is about in vitro studies, not in vivo studies. So I have mostly data about the material itself, and it doesn't include the age of the patient and the population. But if we can print dental zirconia with good reliability, with good strength, with good hardness, then I see no possible causes not to use it for every implication possible. So if a patient has a trauma and it's just a child, why not?
Yeah.
Yes.
Yeah, normally not enough data for pediatric populations. Is that this is the problem? But otherwise,
Anything about the perception of dentists about this new solution about 3D bioprinting?
So yes, thank you for your question. So dentists love 3D printing because it's quick, it creates multiple objects at the same time, so it's more time efficient for them to use printing instead of milling. And also, if you only look at the material prices, it is also cheaper. So dentists love printing, but because of the advancements and the status of these material, that cannot be there, we cannot use printing for every dental material yet, mostly composites or acrylic based restorations, and now we are introducing them for ceramic restorations as well. And this is important because these are not temporary but definitive restorations which can last a lifetime for the patient.
I don't know the word, the body, the metal body of this restoration is also printable or not?
So basically for dental zirconia, the big pro is that we don't have a metal body. So it is
No.
just the ceramic. But if we have a restoration that has a metal basis, we can print metal as well. So this is selective laser sintering. It is already applied in dentistry. We use it at our clinic as well. So basically, we are printing a metal framework from metal dust. And we use lasers to make the dust of the metal into fluid, so to melt the dust, and it becomes a whole structure at the end. So yes, we can use printing regarding metal frameworks as well.
Thanks.
My question for the first topic is also regarding the implementation. Is it hard to learn this new technique because it costs to buy the machine, but does it cost much to train the people whom you work with or to to have the ability to work with the printing rather than the milling?
Thank you for your question. So basically, it doesn't really influence us dentists. So we have to be really clear, and we have to know the implications of printed materials. But other than that, I think that from a dental technician's perspective, who actually designs these restorations, they have to use the same designing system for the printing and the milling. One possible extra factor is the post-processing of the materials. So when we mill zirconia, we have to just put it into a furnace, so it sinterizes to the final form and strength and shape. But if we are working with printed zirconia, first we have to put it into a solution to remove all residuals from the printing. So it comes with a few extra steps that are really easy, I think, to implement it to practice. Maybe you need a few extra equipments, but nothing terrible.
Thank you very much. I have another question, maybe related to the second topic. If I understand well, maybe it's a naive question. You are looking at one-arm studies that evaluate how zirconia changes in time due to certain aggressions. Why are you looking only at zirconia and not comparing maybe options, materials for restoration? Why are you looking only at this and not including also a comparative approach in your second study?
Thank you so much. So this is a really good addition to my project, because I mainly focus on dental zirconia, and I compare the aged material to the baseline. So these are one-arm studies, but if I can find enough two-arm studies, or maybe enough articles on other materials, I could possibly compare whether, for example, another ceramic has better color stability, and why it should maybe it be if a dental material has better color stability, for example, than printed zirconia. And this can also influence indication as well. So if I find out that printed zirconia has good color stability, I have just a bigger palette of dental materials I can work with.
I would ask, I think, a very simple question, because I'm not a professional in this topic. Regarding to your second project, you mentioned that you are planning to measure color changing, and you wrote delta E. What does it mean, delta E?
Thank you for your question. So delta E is a measure of color difference. So basically, it shows us the value of the difference of the color to the baseline. So if delta E is below a certain level, so it is small, then if there's a color difference, it is not perceptive by the human eye. But if it's big, then it means that we can see the difference, and this is a difference that we cannot accept. So basically, if the material has a discoloration that is like really strong, then the delta E is really high. So basically, this is a measure for color difference.
In your first forest plot, can you go back to that? There was one single study on the other side of the plot. Did you investigate what might be the reason behind that?
Yes, thank you for your question. So we had one outlier, which is an article from Ravia Leon. And I don't know if you can see the study names correctly, but from this very same author, we have the last article on the first plot as well. And as you can see, it is on the complete opposite side of our forest plot. And we investigated, because this is really prominent. This is a really prominent difference, and we found out that during this 1 year, they used a different type of printing method, which is LCM. This is lithography-based ceramic manufacturing, and we looked into it, why it could give us better results for printed zirconia than for milled zirconia. And we came to the conclusion that this is a really good printing technique, which was invented by a Litos company. And this is unique for them. They developed a printer, they developed a material for it. So this is a closed system, and it can give us really high strength. And we also investigated the flexural strength testing method, and we saw that everything was adhering to the national standard. So we couldn't find any reason to dismiss this article. So everything was done by the plan, so by the protocol. This just means that this manufacturing method, this LCM, lithography-based ceramic manufacturing, has maybe really good potential in the future.
I see on the plot the third study also used LCM.
Yes, but if yes,
Is there any? Did you look into that?
yes.
The first
What
and the
is
third.
interesting is in this study we don't have an information about the printing orientation. So you can see the loading direction column. This means that the material was loaded perpendicularly to the printing direction, which gives us the best value. But in the third article, we don't have an information about that. So maybe the printing orientation was different, and this is why this material didn't withstand forces.